Hi, I'm Karen, and I have primary lymphedema. Today I'm going to be talking about something that's a little bit more serious than what I've been talking about lately. It's pain and lymphedema, infection, lack of understanding from doctors, or actually lack of knowledge from doctors. I've had a rough last couple of weeks. I ended up with infections in both legs. Now, most people don't really think of what the issues with lymphedema is. Most people think, oh, her legs are swelling. She can't find shoes. Too bad, so sad. But in reality, there is pain involved. I know a lot of doctors think, oh, no, there's no pain. And maybe some people don't. Some people just have the heaviness. I personally have had pain for decades. It wasn't until I got my stockings that I ended up not having the lymphedema pain anymore, which was wonderful. And now I end up with the infections. I get infections about once a year. It always happens on a Friday. Don't know why. That's how it happens. So I always have extra meds on hand for when it happens because I can't get into the doctor right away. So I started taking my meds right away as soon as I start feeling it happening. I know when it's happening. I've had this for years and decades. Anyway, so I started taking my meds. That was fine. And then Monday morning, I called my doctor and made an appointment. I couldn't get in until Wednesday, but I knew I had enough meds to do that till then. So I got in. I was taking my meds the whole time, but I was noticing that I wasn't getting any results, and it was getting worse and worse. I was in a lot of pain. I ended up having to go into emergency on Tuesday night with extreme pain. Now, I dread going to emergency because you never know what kind of doctor you're going to get, what kind of knowledge base they have. I've never been either bit lucky when it comes to finding somebody who knows something about lymphedema. I've never met a doctor who's known anything about lymphedema, to tell you the truth. So I ended up going to the hospital. I ended up waiting for a few hours. They got in to see me, and I got in to see them. And they didn't know what to do. They said, well, just make sure it's not a blood clot. I want to get an ultrasound done. So I had to come back in the next day. I said, well, do I wear my compression, not wear my compression? He said, no, once you get your ultrasound done, we'll deal with it then. So I went and got my ultrasound done the next day. Then I ended up having to wait almost 6 hours in a chair, sitting straight up and down. While I'm waiting, my legs are getting bigger and bigger and bigger until finally they start breaking open. I kept trying to tell people, like, I shouldn't be sitting like this. They kept saying, oh, no, you'll be seeing someone soon, so don't worry about it. So my legs were continuously just getting worse and worse until finally I got to see a doctor. This doctor came in and said, primary lymphedema? I don't even know what that is. How do you even get it? I said, well, I'm born with it. It's just the way. He said, oh, I didn't know that could happen. Anyway, so that's what I get when I go to the emergency rooms. The doctors don't know. So I told him, well, my meds haven't been working. So he gave me a stronger prescription and come back in a few days. So that's what I did. I started with the stronger prescription. The pharmacist was great, told me all the different issues that this meds had. So I ate a lot. I drank a lot of water with it, exactly what she said to do, but it was just making me sicker and sicker. It was horrible. So I ended up going back to the emergency again a few days later, and I told them, well, no, it's not working. The meds are making me really sick. It may be helping my infections, but it's not really helping my stomach. So that was fine. It's just my legs were starting to feel better. They said, well, just give it a couple more days and then just get off the meds. So that's what I did. But now, it's a week later, I can feel the infection coming back. I'm panicking a little bit. Try to get in to see my doctor. Can't get in to see her. I'm out of meds. My only thing I have to do now is go into emergency. Do I want to do that? No. I don't feel it helps. It just made it so much worse. My legs are still not over the issues that I had from going last time, which was the breaking open, end up with more sores. I've been getting really emotional about it lately because it really upsets me that there's absolutely no doctors to talk to about it. Something has to be done. Anyway, that's it for now.